Anytime you have a child who has AS, you want to also make sure that they are aware that if they marry somebody who has AS, they could both get together and have a child who has SS, because each parent will contribute that sickle cell gene.
Hello, welcome back to Pediatrics To-Go. Today we have Dr. Sanusi. She's going to introduce us to sickle cell disease and its crisis. I'm Francisca, your co-host and facilitator. And up next, we have Dr. Sanusi introducing us to everything you need to know about sickle cell disease.
Okay, hello. Thank you, Francisca. Today we're talking about sickle cell, but we're only doing the introduction. And the reason is we do have a lot of children who have sickle cell disease, or they might have the sickle cell trait. Now, where does sickle cell disease come from and what is it? It's actually a disorder of the hemoglobin protein in the beta carrying chain of the blood. And it's a blood disorder. It's actually genetic. Every time a parent or two parents that have the sickle cell gene, so if you have two parents who are AS, there's a 1 in 25% or 1 in 4 chance that every time that child, a family with a sickle cell gene gets pregnant, that it will be passed down to the children. Now, genetics basically is the major determinant of a child who's going to be a sickler. You have the hemoglobin. So people talk about genotype and blood type, and they get that confused. So a genotype is actually
Genotype and blood group.
Yes, blood group. You either have A, B, or O, but genotype usually either AA, AS, or SS. And there's also SC, or you could have AC.
AC, yes.
So if you have two parents that have AS, so that means each parent, there's a higher risk to have a child. And that's why anytime you have a child who has AS, you want to also make sure that they are aware that if they marry somebody who has AS, they could both get together and have a child who has SS, because each parent will contribute that sickle cell gene. And anyway, that's all about genetics. But the bottom line is, if both parents are carrying the sickle cell gene, if one parent is AS and the other one is AS, if your child ends up being SS, the child will be born with the sickle cell gene, and that puts them at risk because the hemoglobin is not normal. So sickle cell, the reason it's called sickle cell is when the blood is passing through the small vessels of the body, it can change in shape, and then you have cells that are hard to pass through the blood vessels, and then that can cause blockage of the blood vessels. And when you have blockage of any extremity or any part of the body, when there's a decreased blood flow to any part of the body, it can cause severe pain. And when those children are born, usually they don't have any problems because there's something called the fetal hemoglobin that is normal, or that protects the child until the age of 6 months, when the bone marrow starts producing the sickle cell gene, the sickle cells.
Okay.
And the abnormal cells now start to manifest as severe pain in the extremities, because that's where you have the small blood vessels, or the child might be very fussy. And a lot of children who have sickle cell disease also have an abnormal immune system. So they are more at risk for infections, and they need to be followed by a sickle cell specialist. We do have a lot of sickle cell specialists all over the world. Here in Nigeria, in the United States, we have big institutes that usually it's a hematologist or a blood specialist, a pediatric hematologist, or a pediatrician like myself who are specialized in hematology, that will take care of those children. But if both parents know that they have AS, get your child tested as soon as they're born. If there's no routine newborn screening, because in the United States, for instance, every child that is born, they do the filter paper test, where the blood from the nursery, the child's blood is put on a blotting paper and sent to the National Registry to be checked for sickle cell. And if it's positive, the parents are notified usually within weeks that your child has the sickle cell gene. So if they're either carriers or they actually have the disease, they're notified. And then that child sees the pediatrician, who refers them to the sickle cell specialist, and then they start to get the care from when they are born. But sickle cell disease is there's a whole lecture attached to that. We're just doing the introduction. So if parents know that they both carry the sickle cell gene, and usually families know if they have that gene. So if you know that you're AS as a mom and dad, you know you're both AS, make sure you get your genotype of your child checked. And that way everybody's on the same page, and you start seeing a doctor early for the child, a hematologist. And anytime the child starts to have crisis, that's a whole different topic to talk about. You can go ahead and have the child taken care of by the specialists that are experts in that field.
So how can one, okay, it's already, the cause of sickle cell, you already said, is genetic, but like, imagine one has a child now, the child has sickle cell disease. So how can one manage it? How can the parents like manage sickle cell with the child? Like
that's why you need to see the specialists, because they are teams.
Okay.
They are actually teams that will support the parents on what to look for when the child starts to have crisis, whatever crisis it is, how to recognize a crisis when they have a fever, why they need to go and see the doctor as soon as possible, because that fever can be quite a problem based on the fact that the child is immunocompromised. And then most children that have sickle cell, usually they're on antibiotic prophylaxis, usually a penicillin. And that's just because since their immune system is not that great, they need to be protected. So if they have any bacteria in their body, the prophylaxis actually prevents them from getting very sick. So most children with sickle cell, they are usually on folic acid. They're usually on a nutrient-rich diet. They could be on hydroxyurea, which is a medicine that helps to increase fetal hemoglobin. But the sickle cell specialists, they know what needs to be done, especially depending on what area of the world you live in. So it's always good to go to the university hospitals where the specialists are. And it's always better to be followed by the specialists who are experts in that field, usually a pediatric hematologist or a pediatrician who is specialized in sickle cell. So I want to encourage all our parents out there, if you know you have the sickle cell gene, check out your child's genotype and make sure they see a pediatrician who is a specialist in sickle cell disease. So that way your child will get the care they need sooner than later. And parents will also be educated on the best way to prevent sickle cell crisis and the best way to care for your child. Thank you for listening. And this is really for patient education. And we want to live the world better than we found it. Thank you.
So until next time, bye.
Bye.